Our greatest concern is the potential for the virus.
Welcome to Min&JeanTV.
So Jean,
Yes.
I brought this mask today for you and for me. And then I brought this hand sanitizer.
The coronavirus,
Mhm.
right, is spreading. And
Yeah.
people are getting really worried.
We call that Wuhan Perion in
Oh,
Korean.
okay.
So the Wuhan is kind of big city in China,
Okay.
and it's famous for buy and sell, you know, for everything.
As a marketplace.
And, yeah, many people
Coming
coming
and
and
going.
going. Yeah. So I think that caused this, you know.
To be more severe.
Yeah,
Sure. The time of year when the outbreak began, because lots of people, you know, we just had the Lunar New Year holiday, and so people travel during that holiday,
Yeah.
and
Abroad especially.
especially abroad. Yeah.
Or, you know, China is very huge. Oh, sorry. China is a very huge country, so they are, you know, moving farther.
Because it's traditional to go home and visit your family, right?
Actually, yeah, that's
Yeah.
true. So in Korea, we've got like 3 days off for the holiday, Lunar New Year's Day. But in China, they got like 1 month. Yeah, it's very long holiday and the biggest holiday in China.
Sure.
So they've been saving
Yeah.
the money for the holiday, spending for their family, traveling.
Sure.
So they booked tickets
Right.
for the flight and
Sure.
train, or they just, you know, went everywhere. Yeah, maybe they were holding the virus inside of their body.
Yeah. And they might not have known.
Yeah,
right? we talked about it has
or
a long...
they didn't take it very serious
Sure.
at the time. But nowadays it's revealed it's very severe.
Sure.
Yeah. Did you
Yes.
see the clip of declaration of WHO today?
Yeah, they declared it a emergency situation.
Yeah.
Yeah.
Do you wanna watch that?
Sure, let's take a look.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
What they're concerned about is with people traveling that the virus might spread to countries with weaker healthcare systems, where people might be even more at risk
Right.
without treatment.
Yeah. Like for example,
The elderly,
The
sure,
elderly
young
or
children
young
especially
children.
are always vulnerable. And this is it attacks the immune system. So anybody who has what they say a compromised immune system, so people who have cancer and who are doing chemotherapy, people who are already dealing with some immune system problem are going to be extra at risk.
Over the past few weeks, we have witnessed the emergence of a previously unknown pathogen, which has escalated into an unprecedented outbreak and which has been met by an unprecedented response. As I have said repeatedly since my return from Beijing, the Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people.
And so he's saying that the outbreak of the disease, of the problem, is unprecedented. It hasn't happened before. But he's also saying that the reaction from China is also unprecedented. he's being very careful, I think, in saying that, you know, China has done well once they realized that it was a problem. I'm sure that different people have a lot of different perspectives on that.
Yeah.
But he's probably, as the World Health Organization, he may be thinking of it from a medical perspective. And he also has to be more neutral. Sure. He's not talking about sort of the sick individuals, right? He's talking about once it became a public health issue.
We would have seen many more cases outside China by now, and probably deaths, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world. In many ways, China is actually setting a new standard for outbreak.
Yeah, so he's saying that it could have been much worse in terms of deaths in China and then deaths in the rest of the world by this point.
Yeah.
So
I saw the video about Wuhan recently. Yeah.
Was that the video you sent me?
Yeah, it looked really like a ghost town.
Absolutely.
That means it's just closed and shut down the city.
Yeah. There was almost no one.
Yeah.
구독
눌러
주세요.
Min&JeanTV.
I would like to summarize those recommendations in 7 key areas. First, there is no reason for measures that unnecessarily interfere with international travel and trade. So WHO doesn't recommend limiting transfer or trade and movement. We call on all countries to implement decisions that are evidence-based and consistent. WHO stands ready to provide advice to any country that's considering which measures to take. Second, we must support countries with weaker health systems. Third, accelerate the development of vaccines, therapeutics, and diagnostics. Fourth, combat the spread of rumors and misinformation. Fifth, review preparedness plans, identify gaps, and evaluate the resources needed to identify, isolate, and care for cases and prevent transmission. Sixth, share data, knowledge, and experience with WHO in the world. And seventh, the only way we will defeat this outbreak is for all countries to work together in a spirit of solidarity and cooperation. We're all in this together.
7 points.
Yeah.
Point number 1. The World Health Organization sees no reason to limit international travel and trade.
Oh.
Point 2, support countries with weaker healthcare systems. Point 3 was to speed up the development of vaccinations and ways of diagnosing the disease.
I hope so.
Yeah. The 4th point was to fight against rumors and misinformation.
Yeah, I heard a lot of rumors.
I looked at an article on Twitter and there's a lot of garbage in there. Not in the article, in the comments. He said that countries should review preparation plans for this kind of disease, and that they should identify any gaps, any weaknesses. That the 6th point was that countries should share information, resources for fighting the disease. And then also that countries should work together in solidarity. I think what he's doing there is reminding us that the disease is the enemy, not people.
Yeah, actually, this is very important situation because the WHO doesn't really, expose this kind of, declaration all the time, right?
So they don't do this very often.
Yeah.
So it's serious, but no need to panic, I think. That's what they're saying.
Yeah, actually, around me, there are many people who have little children.
Sure.
Yeah, they don't send them to the school or daycare center because of that event. Yeah. And also, I'm thinking about that as well. But I don't know. But just we can do our bit.
Exactly.
Yeah.
There are no guarantees, but you do your best. And I think we mentioned earlier, wear a mask, use the hand sanitizer, maybe spend a little bit more time at home, try to limit your exposure without, hiding. And hopefully, they can solve the problem and come up with a vaccine fairly quickly.
Yeah. Hopefully there's no more victims or cases.
Sure.
Fingers
Hopefully.
crossed. Yeah.
Join us.
Subscribe to our channel and
Please
then
do.
keep yourself updated with us.
Absolutely.
Bye.
Bye.
Let's go.
Okay.
Min&JeanTV.
TV.